Causes of abdominal discomfort that can be common in pregnancy. There are a few harmless causes of abdominal discomfort in pregnancy, and here's everything to expect from them, and how to ease them. Growing uterus. Getting full up more quickly than usual when eating, and suffering from indigestion, nausea, or bloating. The likelihood is that you are feeling the effects of your growing uterus. This is completely normal and can be helped by eating smaller meals more regularly, doing some gentle exercise, getting plenty of rest and going to the toilet as soon as nature calls. Ligament pain. As your pregnancy progresses, at times you may begin to feel an uncomfortable stretching sensation in your lower abdomen and down into your groin, especially when you change positions. One possible cause of this is the stretching of the ligaments that connect your uterus to your groin area, one of which is called the round ligament. This usually resolves itself over time, but if it is causing you a lot of pain or if you have any concerns, it's a good idea to speak to your GP or midwife. Constipation and trapped wind. You probably know what constipation and trapped wind feels like. Unfortunately, it can get worse during pregnancy. The culprit is usually your changing hormone levels that slow down the whole digestive process. To help combat wind and constipation, drink lots of water, eat fiber-rich foods, or talk to your GP or midwife about taking something to get things moving again. Braxton Hicks contractions. As your pregnancy develops, you may experience tightening of the uterus/womb, known as Braxton Hicks. Unlike contractions, these tend to be short, irregular, and may cause some discomfort but should not be painful. They won't get closer together like contractions either. If the tightening persists and you can't identify whether they are contractions or not, call your midwife or the triage at your maternity unit. Warning signs of more serious problems. There are a few symptoms that you should keep an eye out for that could be more cause for concern. We'll cover all these symptoms and what they might mean below. However, please do bear in mind that you may not have all the symptoms listed, so if you are ever unsure, it's best to get checked over. Ectopic pregnancy. Symptoms: lower abdominal pain concentrated on one side, vaginal bleeding or brown discharge, pain felt in the tip of your shoulder, discomfort when going to the toilet. If you have the above symptoms at between 4 and 12 weeks, you may be suffering from an ectopic pregnancy. This means that the egg has implanted in the fallopian tube or somewhere other than the uterus. In this case, you should contact your hospital A&E department or early pregnancy unit straight away. Miscarriage. Symptoms: cramping and pain in your lower abdomen, abnormal discharge of fluid from your vagina, discharge of tissue from your vagina. Miscarriage is a common concern for all newly pregnant mums. If you experience cramps and/or have vaginal bleeding, miscarriage may be the cause, although there may be other reasons that this can happen. It is very important to get in touch with your midwife, hospital A&E department or early pregnancy unit straight away. Premature labor. Symptoms: regular painful contractions, a sudden breaking of waters, ASHO, mucus plug coming away from the cervix and out of the vagina, before 37 weeks gestation. If you have any of the above symptoms, you must call your delivery suite and attend your maternity unit right away. Your hospital will be able to assess you, and it's important that you are in the care of people who know what they are doing as soon as possible. Placental abruption. Symptoms: stomach pain, frequent contractions that can seem continuous, bleeding from the vagina. The placenta is your baby's source of oxygen and nutrients. It usually remains attached to the wall of your uterus until after you have given birth. Occasionally it can detach from the uterus too early in pregnancy, which is called placental abruption. If you experience the above symptoms with or without bleeding, it's crucial that you are seen in your maternity unit as soon as possible. Preeclampsia. Symptoms: severe heartburn, pain just below the ribs, severe headache, nausea, fluid retention, vomiting, flashing lights or starry vision, swelling of feet, ankles, face, and hands, usually after 20 weeks gestation. Preeclampsia is a condition affecting the development of the placenta during pregnancy. Moms suffering with preeclampsia may experience the above symptoms along with high blood pressure and protein in their urine. The condition can be harmful for both mom and baby, and it is very important to call your midwife or hospital as soon as any of these symptoms occur. Urinary tract infection. Symptoms: dull backache, constant dull pain in the pubic region, cloudy and unpleasant smelling urine, need to urinate more often than usual or passing small amounts, usually accompanied by discomfort when urinating. These are all symptoms of a UTI, urinary tract infection. Although not usually an emergency, UTIs are more serious when you are pregnant, as untreated infections can lead to complications in pregnancy. Thankfully, UTIs are easily treatable with a course of antibiotics. If you think you might be suffering from a UTI, get in touch with your midwife or doctor who will be able to confirm if this is the case and offer the most suitable treatment. You know your body best. Pregnancy discomfort is common and is often nothing to worry about. But you know your body better than anyone, so if any aches or pains are worrying you, make sure you talk to your midwife.